celebrating Black History Month. And today we want to talk about lowering your cholesterol naturally. So perhaps your doctor has told you that you are pre diabetic or you're diabetic. How do you actually get those numbers down? But let's first of all talk about what is cholesterol. This information that I'm going to provide you is for educational purposes only. You always want to consult with your healthcare provider, your physician, your therapist as your number one point of contact. So, this information is for educational purposes only. I'm Dr. Frances Richards, and thank you for joining me live at 5 with No Jive. We're going to give you straight talk about your health. It's really about living your best life. It's about managing your weight, and it's also about managing mental wellness because we know that your wealth is your health and your health is your wealth. If you don't have your health, you can't get your wealth. So we want to make sure that you stay healthy no matter what you're trying to do. So, cholesterol is a waxy substance that is found in your blood, and your body needs cholesterol to build healthy cells, but high level of cholesterol can increase your risk of heart disease. Now, with high cholesterol, you can develop fatty deposits in your blood vessels, and eventually these deposits they will grow, making it difficult for enough blood to flow through your arteries. Now, sometimes these deposits can break suddenly and form a clot that causes a heart attack or stroke. So, we want to make sure that you keep your cholesterol numbers right. Now, do you know what your cholesterol numbers are? And so it comes in milligrams. You may see the MD, that stands for milligrams, or you may see the DL, and that is for deciliters. So a milligram is 1,000 of a gram, and a gram is about 130 of an ounce. So a blood sugar level less than 140 mg over DL is normal. And so if you have a reading of more than 200 mg DLs, that's mg over DL, after 2 hours, mean you have diabetes, and a reading between 140 and 199 mg over DLs mean you have pre-diabetes. So here are the ranges for your total cholesterol in adults. Normal is less than 200 mgs over DLs. Borderline is 200 to 239 mgs over DLs. High is at or above 240 mg over DLs, and optimal less than 100 mg over DLs. This is the goal for people with diabetes or heart disease, and near optimal is 100 to 129 mg over DLs. Now, what causes you to have high cholesterol? Eating fatty foods, not exercising enough, drinking alcohol, often having a resulting in an unhealthy lifestyle, smoking, which makes it preventable. So, what you can do is you can actually prevent diabetes. Sometimes they say diabetes can run in your family. It could be hereditary. You can lower your cholesterol by eating a healthy diet and getting more exercise. One of the things you want to understand that there is no symptoms when you have diabetes. In order to detect if you have diabetes, you need to have a blood test. A blood test that's the only way that you're going to detect that. Now, some of the factors that can increase your risk of an unhealthy cholesterol level is we talked about a poor diet. If you're eating too much saturated fat or trans fat can result in unhealthy cholesterol levels. Saturated fats are found in fatty cuts of meat and full fat dairy products. Trans fat is often found in packages of packaged foods, snacks, or desserts. And when you are obese, having a body mass index of over 30 or greater puts you at a risk of high cholesterol. So, lack of exercise is another thing that can cause you to have your cholesterol high. So if you exercise, what that's going to do is boost your body HDL, which is your good cholesterol. Smoking, cigarette smokers, when you're smoking, what happens is that cigarette smoking may lower your levels of your HDL, which is your good cholesterol. And they have found that even young children can have unhealthy cholesterol, but it is much more common in people over 40. As you age, your liver becomes less able to remove the LDL, which is the bad cholesterol in your body. So we've talked about what is high cholesterol. We talked about the levels. So let's give you some strategies. Here are some heart healthy lifestyle changes that can lower your cholesterol and prevent you from having high cholesterol. Eat a low salt diet. And so you want to eat the rainbow, eat a lot of fruits and vegetables and whole grains. You want to limit the amount of animal fat and use good fat in moderation. You want to lose extra pounds and maintain a healthy weight. Quit smoking. Exercise on most days, and that's a minimum of 30 minutes a day. And drink alcohol in moderation, if at all, and you want to manage your stress. So these are some strategies that you can incorporate. Let me know which one of these strategies or tips that you're going to incorporate. It is overall just having a good balance to having a healthy lifestyle. I want to reiterate, you want to eat the rainbow, limit the amount of animal fat. This is some strategies if you need to lower your cholesterol, lose some extra pounds, maintain a healthy weight, quit smoking, exercise at least 30 minutes a day, and drink alcohol in moderation, if at all, and manage your stress. I'm Dr. Frances Richards, and we are here giving you some healthy tips. If there's a subject matter that you would like us to discuss, feel free to leave it in the chat, or you can always text me at 702-781-0069. We'll see you back here tomorrow, live at 5 with no jive. Remember, before you engage in any exercise or eating plan, you always want to consult with your physician. Have an amazing day, and we're celebrating Black History 365 days. Take care.